What's good, people? This is episode 269. This is the Option Podcast. That guy over there looks like Dr. Tommy Rhee. We're going to find out. Buckle up, people. The episode starts right now. Once again, this is episode 269. This is the Option Podcast along with Dr. Tommy Rhee. I'm Jason DeBeas. What's good, my friend?
I am doing awesome over here in sunny Florida. Now we got a cold front coming through, so it's an interesting day.
Yeah, it's been kind of desert weather here, the usual winter in California. I know you're a California kid. I live in Hermosa Beach, so there were some mornings it was 44, but I'm like, dude, let's just move practice to 1 o'clock, right? There's no hot sand, and you know what I'm saying? The sun sets a little earlier, so making everybody jealous, man. What are we doing? But on a bi-coastal level, Mr. Tommy Rhee.
Yeah, I always beat you in the sunrises, but you got me in the sunsets there.
Nice. All right. So for those of you that have been living under a rock, Tommy Rhee is a chiropractor amongst many other things in the medical field, well respected in this community. Team chiropractor for the Tampa Bay Buccaneers, and has also done some work at UCLA for their track and field team and their football team. And there are a couple of other universities, but if I start reading off the whole list, man, that takes up the whole hour, and that is unfair to you, my audience. So Tom, we are going to talk about some high level stuff, but allow me to be a little bit novice and just ask, you graduate high school, you're going to college, right? What the heck made you get into medicine, much less the chiropractic practice?
I think the common thread with all of us sports guys, I hope it's that we play sports. So we know what that world is as far as like training, playing games and performing and loving that environment of like that competition. So as you go into the later stages of like, for me, I'm not a tall guy. So as far as going beyond like professional world, I know I'm not going to be that person. So I still want to be around that stuff. And I knew the route I want to take was to be in that environment, but take a step into maybe provider, the medical side, the support, the actual injury side of things. So that's the big thing is that, to be around that environment and trying to do the best for your athlete, this is the best impact for them. So I treat myself like almost like a mechanic in a race car. So the race car, the driver, the athlete, they're trying to break the car by maximizing their output. And I'm there just trying to repair them, get them back on the court or the track to get the best out of them. So it's one of those things that married really well together. So I guess, also thinking about like in the past where my dad, uncles, everybody in my family are in that doctor world and seeing that provider side of things, it just blended well where I ended up at.
I think it's interesting that you said you're not very tall, because I think going to some of these sports, we assume we're like normal sized people, like I'm 6'1", and then as you start to level up, right, and the elite athletes are a little bit bigger, they're taller, a little bit faster, stronger, and you're like, okay, I'm not tall. 6'1" is not, dude. 6'1's not tall.
You always get like, how they say, the fighters always say, don't think you're the best. There's always someone out there that has that edge. So you just keep training and you keep working out. But with height, they can't teach height. So that's why I went in this path.
No, I totally agree with you. I'm a former player, and again, moving to New York, 6'1" is considered tall. I live in Hermosa Beach. This is like normal size, right? I mean, I think like 4 out of every 10 girls I walk by are 6'1". It's also, I think it's also like Manhattan Beach and Hermosa Beach is kind of like for the hotbed for where beach volleyball players reside. So
Oh
it's
yeah.
no big surprise to see tall people and their children. All of their kids are big, and I think I speak for both of us when we say whatever's in the drinking water that makes you like 6'4", 12 years old. I'm like, man, I wish I had some of that Kool-Aid growing up.
How about some of those kids that get that growth spurt during college? You bring him on, he's like 5'10", all of a sudden, bam, he hits 5 inches. Like, look at this. The coach is like, we got ourselves a star here.
Wow, yeah. Where'd you go to school?
So, as far as like the high school here in Tampa, Florida, and then
Mm-hmm.
the military sent me out to the West Coast. So I was stationed in San Diego,
Mm-hmm.
and then went to after I got out of the military, I went to Costa Mesa, Orange Coast College, and played football there. Then went to Pepperdine, and then during that time, I had that met my girlfriend. The old girlfriend slash got her pregnant. 3 kids later, I've got to work, go to school at nighttime, and it just evolves from there. So
You're a very unique case. And I promise you guys we're going to get into the medical stuff, but it's all logically connected to his military service and his discipline and how, as I saw in previous podcast, what helped you set up your foundation and some of your common denominators that led to your success. Um, Interesting stat I saw in 1990. Out of every 10 people who joined the military, right, 9 of them were saying one of the reasons was college money. And of those 9, 4 of them stayed in, re-enlisted or became lifers. 5 of them got out. And of the 5, only 2 of them went to college. And like of the 2, only 1 graduated. So,
wow.
so you were the one that graduated. I'm ex-military. I'm a Gulf War vet, and I was the one that was supposed to not graduate, but I came back and finished. So it's very unique that we're part of this small number to that statistic.
So do you remember there? Okay, so you always had in back your mind that there's something bigger and better when you're in the military, right? So I said when I get out, so I remember like I mean, I was one of those guys that went in the military because of my little behavior. I got in a little trouble. I wasn't like the wild kid, so I really didn't have any options. I knew that it's either a path of bad or go in the military and get myself straightened out. So I was that kid. I was smart, but I was in tune with like reality and society's like norm. So I got in trouble. It straightened me out a lot. But I remember in the military, like, I knew that I was destined for something. So then I knew that I had to get out of the military. It straightened me out, and now it's time to move on forward, right? But when you talk about that group of people, so you know that there's a group of people that are going to stay in, and the other group is going to like try college, and you kind of see that you are different from these people. You're different in some kind of side of like reality when they think, and how remember in the military, a lot of people talking stories that I can't wait to do this, and there's a lot of talkers. I got this, I got that. But there's no action guys, and the action guys are the ones that really just keep their mouth quiet and just do. So when I started seeing that, I said, look, I need to get out of this thing because I know that these guys in the military, that they're basically kind of screwing things up in their world. They're going to continue that pathway. So it was time for me to leave. So I knew where I was going to go once I got my standard like foundation correct, and then moved on from there.
I think I agree with you, and I remember you having a previous conversation like everybody should like serve a year and a half just to have like a grounded discipline thing. Like some of the things I thought the military brought to the table was there's a value of being on time, right? Look, I live in California. Nobody here's on time. Me being just having the discipline of being like if you are, if you're 5 minutes early, you're on time. If you're on time, you're late. If you're late, you're fired, right? Um, Everybody's like, "What's he doing here?" I'm like, "What time are we supposed to be here?" So, also the discipline of you get out of boot camp, right? And you're like this new man. Maybe your parents go to your graduation party. You're standing up straight, right? You're calling people sir, ma'am. You're holding the seat for people. You're like very, very polite. You're in the best shape of your life. You're literally par for the course, standing tall and looking good, as a military chant would say. So there's a value in keeping that virtue and bringing that there that um, has this baseline light to shine. Whatever you put on top of that, because your ability to keep going is icing on the cake. But like that baseline where people are like, okay, on their worst legs are like he's normal, and on their best legs, no, there's something special about this guy. And I think from I can speak for many people, for myself. That's what the military's done for me and coaching, and all the
Yeah.
rest is theater performance.
Yeah.
My degrees in
But
that.
but the one thing that I have a connection with when it comes to like military and repetitive and then going in the sports world, repetitive and it's really kind of like just making a habit out of something that either you can make a good habit or a bad habit, but if you focus correctly, the military teaches you repetitively to just continue on, move forward, micro wins, and then accomplish those things. And then when you get out, you if you keep that same principle, you apply it to anything else. Life is real simple. I mean, you might think, hey, maybe someone outside of you say, hey, you're doing a lot, but in actuality, you're not really doing. You're just doing these little fine-tuned things, and it's just a progression that you where you were at in the military, and then you just continue on, and it's like it's not a big deal. Like getting up, being early. It's not. It's. I don't think it's that extra effort. It's like some when people tell me, "Wow, you're extra," or "You're doing more." I'm like, not really. This is just the standard procedure that I do. It's just normal here. So it's
Yeah.
kind of that military still, embedded in me that projects me forward for all these tasks that I do.
Yeah, it's almost like there's a book called Chop Wood, Carry Water, which is part of it. Like, and the guy wants to be like a samurai warrior or something like that, but he has to embrace the process of just the regular everyday labor. And the best way to make that everyday labor is not be tedious, is to appreciate the value in what you're chopping and what you're carrying and this and that, and taking care of that. I guess it's like become the fire, be consumed by it. I mean, I'm not sure that that's what I'm trying to say, because that's not an indefinite or like a residual solution either. But it sounds cool. So so this is the longest you've gone about without talking about medicine. So
No, no, no.
let's.
I like it. I like it. I like it that when we talk about like sometimes I'll sit back and I really reflect and I see who am I and where I'm at. You know how we're moving forward and it's like we're always looking in the future. It's never a present or the past thought process. We're just going future, future, future. So then once in a while you do reflection and you see, okay, who am I right now and where was I at 2, 4 months ago, years ago, and then you start looking at yourself all the way from, military, college, whatever you're looking back at, and you're saying, was I in that same mindset back then as I'm now? And of course, it's not, right? Because every time you go through anything like we call adversity or challenges, it builds character and you're put into this kind of new person that you're building, right? Every time you're going to that fork in the road, the difficult task is the right task or the right path, and you continue on and you build that person. So, looking back at what I was at and then where I'm at now or where I'm going, it's definitely a different person. So it's interesting that when people think like, oh, I can't be that person. Oh, but just looking at me, you can definitely be exactly where I'm at, even more because I should not be here. I don't know, I just know that what's instilled in me and then I guess my passion of what I do and I focus on what I want to do and I disregard all the noise outside that and just continue on and then enjoy the journey, enjoy the
do,
ride and just keep going forward.
but do you have any idea how valuable, like, just you having these conversations, like you got a book, I guess that's out or coming out or whatever, and of course consistent with that, maybe a little podcast tour and talk to people. Do you realize that what you're doing and people listening to that helps them? Because there are people, like, I'm 55, and there are people in like my age demographic or maybe younger that are just like, man, I've been at this for a while. I surrender. You know what I'm saying?
Yeah.
Like, I don't want to do this no more, right? And for some of those guys, that's like the beginning of the end, right? But sometimes you see a good conversation, right? And you see a podcast, and it's like, why am I sitting here, dude? Roll up. I'm watching what? What am I watching? I'm watching The Blacklist. I could roll off the couch, do like 100 sit-ups. Tell yourself it only takes a minute and a half, right? And then all of a sudden you're kind of back on the saddle, because the residual thing and the discipline is the person, but the inciting incident and the spark is always inspired by someone, right?
Yeah.
Like,
I think the big thing that I can, summarize with what you just said is everybody hears the message in a different way. I mean,
mm,
there's always a different approach, right? So, I guess my personality, probably like a lot of other personalities that are kind of like, stubborn and, like self-renewing on themselves. It's like I'll figure my own way out. And sometimes if I had that ability to listen when I was younger, I could avoid a lot of headaches. You want to go, we all learn through our own mistakes, which is the best lesson in life, but to really like to get the secret is find someone that you want to be and then take the shortcut and then learn from his mistakes and then duplicate his successes. So when I see things like I know I'm doing bad, you know, you go through the process, right? You just push through, and then you'll figure out through your challenges or whatever mistakes that you'll learn those lessons. So I guess the big thing with me is that the lessons, and then just really tuning into like finding that person that has been through that lesson and where you want to go and steal his secrets, steal his shortcuts, and move forward from there.
Yeah, well, there's an old saying, "Oh, good artists create, but great artists steal." Right. So, my degree is in theater performance from Marymount Manhattan, and some of my best performance was, stolen stuff. And I've always sent them a text or a shout out, "Hey, I, borrowed this." Wink, wink, from you guys, But honestly, I do think stealing helps because without stealing ideas, it doesn't allow you to create things on your own, or maybe take their ideas and make them better and run away with it, right?
Hmm.
Like Shakespeare had a predecessor too. It was Seneca. Like all of Shakespeare's characters are Senecan characters. The ghost, the assassinator, the good guy, the good guy's right hand man. Sorry, go ahead.
And the neat thing about these podcasts, these conversational podcasts, it's like the listeners are eavesdropping in our conversation of just talking about what you've gone through, what I've gone through, and they're like, and it's not like I'm preaching to these listeners. It's just that they're kind of eavesdropping, and I feel that when they do that type of listening, they really absorb more. For instance, like if you and I were talking to each other at a restaurant, we're absorbing, but if you have someone that's really curious about what's that conversation about, well, that's what these environments like. It's like you and I having the conversation, and those listeners, they open up their hearing ability. They just listen more. They absorb better. Goes, hey, I can relate to that, or oh, that's interesting. I'm gonna take that. So that's why I love these conversations because it's almost like you and I are just basically sitting at a table over food, and then there's someone at the table next to it just listen to it and goes, ooh, I like that. I see what he's doing. I'm gonna take that idea. I'm gonna take that kind of like topic and grasp and utilize that. So
Yeah,
that's what this is kind of neat with these
that's
podcast
Starbucks in New
shows.
York City, my friend. So when I was watching some of some of the things you've done and led to your path to the topical what's it called again? I'm
Oh, regen.
RheeGen. Okay. Yeah, so guys, RheeGen is something that's a topical solution to well, I'm going to have you walk through that with me in a minute. No, the minute's over. Let's jump into that. You are sorry, I have it right here. Jesus. Through rigorous research and clinical innovation, he brought RheeGen to life as the first of its kind topical therapy built entirely on a cell free platform. And I wanted you to do a compare and contrast to stem cell injections to this. And I know there's risk and this and that. So let's start with stem cell injections first, and then how your topical solution differs and compares to it. The floor is
Okay.
yours, my friend.
All right. So we all heard about stem cell and then the big buzz, they're like live cells. I've got 10 million live cells from injections. I'm getting these live cells in me, right? And then they really talk about these cells and they differentiate into your existing tissue. So it sounds fantastic and pretty much like, like kind of theater-ish because how do you get this tissue and your tissue to match up chromosomes, right? If you go to the basic biology, you want to think about, well, we got to duplicate. We need that code, that chromosome, those genes that say, it's going to turn into a hair follicle, a muscle, a tendon, a ligament. It's got to have that duplicated type of like code that's in your tissue. So it's got to match up. It's impossible that you have those millions of genes, right? Those codes, and they're going to match up to your code. So then you take the next step. Is it the live cells? No, because it's not going to duplicate. It's not going to differentiate like they say. It's about signaling. It's about the signal molecules. These are called cell-free, right? Cell-free meaning there's no nucleus, there's no DNA. You don't need the DNA, you need the messages. Just like how our body needs messages of hormones, cytokines, any type of information that tells our existing tissue to do something. Well, that's the information we want. So that's where this stem cell, live cell difference from topical regen stuff, because we are looking at the signal, the information. So you're starting to see a trend moving away from these live cells into cell free. Like you hear these words like exosome, BPC 157, TB. You've seen all these signals, right? These signals, right? These signals are the information that our body needs to tell our existing tissue to do something, turn on, do that production of regenerating. So that's what this is all about. So the more important thing about is that when you take a cell that's live that has DNA, what is that going to do to your body? You're taking something that's going to duplicate into something. What if it's something you don't want? What if it all of a sudden turns your tissue into something that's
It's
not supposed to
something
turn
like
into?
cancer.
You're
Yeah.
exactly, you're walking into tumor
Yeah.
formation. So that's why you have to be very careful when you take a live cell, right? Because your body's going to do things to like create an antigen, antibody to fight the antigen. It's going to have some kind of battle. So you got to be very careful. So the weird thing about our industry, it's not really regulated, right? So it's really regulated in the sense of the laboratory and how it's like taken away from a umbilical cord, the mesenchymal stem cell, Wharton jelly, all that stuff. But once you get to the clinical world, it's the wild, wild west. I mean, you don't know what you're really getting. You could get bovine, you can get animal, you can get other tissue other than what you're targeting with the high concentration of these signal cells, stem cells into your body. So there's a danger risk on that side. So if you can just understand about the signals and get the signals,
Hmm.
well, now you're in a less harmful environment. Now, the interesting thing about this is that there are plants that have the same ability to signal. Instead of getting it from a site from your own bodies or a donor site like the umbilical cord, there's plants that have that information turned on the existing tissue. Much safer. And the neat thing about that is that when you take that small molecule, now you can do it in a topical application that has a transdermal agent that pulls it through the skin. Now there's no more injection. Because the injection, when you go through your skin, you're getting invasive. Now you're involved with possible infection, trauma. You might even cut more tendon that you don't want, right? You have a primary site, you just create a secondary site of injury. So now you're making more damage. So that's why the you're going to see the trend moving towards topical application. Topical is where it's at, but you've got to get it through the skin, and that's where RheeGen really, surpasses other type of stuff because it gets through the skin. So that's where you see the difference between this injectables and topical.
Um, can dead cells also send messages?
Now it depends. So you have to find out. So they got apoptosis, right? So when the cell like destroys, self-destruction, right?
Hmm.
It does like a message dump. It dumps things out. So there are things that are kind of like sitting in this cytokine. It's kind of like this kind of vacuum of space that's just waiting to grab and then have the ability to do something. So yeah, there's that ability to have signals from that type of dead cell. So yeah.
Wow, that's interesting. Now, I guess my question is there are different ways to practice medicine. There's preventative, right? There is residual, and my personal favorite, reversals. Okay. And I'm not trying to narrow it down to this false trichotomy, which is not a word. I'm just a kid from Brooklyn who likes to make up words because all words are made up. Is this topical solution more of like a residual treatment, or is it something that can manipulate and like improve things, on the body? Because I I worked for a doctor, and because I worked for a doctor for 17 years, I don't really see doctors. After he retired, I don't really see doctors because I don't really trust them anymore, right? Like I have a little bit of cartilage left in my knee. Don't give me a knee brace, right? I can play without the brace. I'm good. You know what I'm saying? It's not, in fact, in many ways, the brace is more painful, and it's also a psychological crutch, too, to remind me I got a bad leg. So, the reason why I was so intrigued and fascinated is because you're doing something savage here. You're like, no, I'm not going to give you a crutch if your leg is here. The whole purpose of me treating you is so you can perform, not so we can have surgery and you can recover and not perform, right? And loaded question. It's not a yes or no. Obviously, not a yes or no question. How much of this is residual? How much of this is reversal? How much of this preventative is psychological. That's a psychological approach, right? Like if I'm hammering my thumb, I'm not going to take painkillers. My mind's going to say don't take the hammer and hit my thumb anymore. Preventative maintenance, right? Pepperonis make me break out. Don't eat pepperonis. The check, I'm charging you for that medical advice. So if you get my question, I'll shut up.
Yeah, yeah.
How much of this is preventative? How much of this is residual? How much of this is reversal?
Okay, so as far as data and scientific papers, There's a lot out there. There's a lot out there about what it does for regenerating tissue. So there's a lot of fantastic, and both in the donor side or the human tissue side and the plant side. There's a lot of information out there. Now the difficulty is that how to deliver it. That's where the question is at. So you need to get it into the tissue through the skin. That's the hardest part, right? So you have to use a needle or a some type of transdermal agent. Once you get in there, now the question is that what's going on, right? So you want to see, does it really regenerate? Does it really do preventative? Are you looking at, keeping it where it's at, or are you going to keep it growing? Like you want to regenerate the cartilage that you have. So those are the big questions that you have to ask, and then you have to answer like, what delivery mechanism? What am I trying to do? What am I trying to do? And there's cartilage, right? They call them like chondrocytes. Chondrocytes make more tissue, right? So you need to get that thing going. Now, here's some of the problems that we have at my age, at 50s. So we have the ability to signal. We have a lot of signals, and when we're like in the 20s, 10s, and all that stuff, right? We're able to recycle fast, right? Heal faster, recover faster, all that stuff. As we age, they decline because the signal declines. It's not so much the cells, it's our signaling ability is slowing down. So we need a brighter, stronger signal. So once we get that right signal, here comes the regeneration need. Now your knee growth on the cartilage increases. You've got to get the right signal. So that signal in the form either the human tissue donor side, mesenchymal stem cells with the EVs or those signalers, or from the plant base. It needs that signal. Once that target tissue hears that message, it says, do your job. And then that's what you want. So the future, if you really look at regenerative medicine, is moving fast. It's moving fast, and it's kind of like we don't know, but there's so much research on just like not only the musculoskeletal stuff, but you're looking at like organ tissue, heart, promising stuff out there. It's big out there. And then you hear about like these amazing stories like, I did this and I was able to accomplish this task and all that. So you're hearing a lot of case study, and it's starting to evolve into the world of that signaling. And you're going to hear less about the actual stem cells and more about the cell-free type of things, like exosomes and then all these like peptides and all these things. That's what it is. It's cell-free, no nucleus, safer environment that signals your existing tissue. So the way I look at it is that if you take an existing patient or person that you look at how degraded they are, if they're like bone on bone, there's no cartilage, well, you can't grow something that's not there. So you're not looking at doing any type of preventative stuff. You're looking at babies basically a lost cause because you don't have nothing to grow.
Right.
Now, if you get them before they start having that like destruction, the complete loss, then you
Right.
have a chance. You have a chance to regenerate that tissue. So
Right.
it depends where you catch them. So there's the way you look at it, or the way I would look at it with a patient that has degrees of condition in that knee or the arthritic situation, is where are they at? Are they really destroyed? Do they have bone destruction? Or are they starting signs of that arthritic world? We like to catch them as soon as possible because the sooner you catch it, you can reverse it. Then you can actually like regenerate that tissue to get that back to a healthy knee.
Right. So generally, if you have a little bit of cartilage, you can work there. If you have none, you might be in a situation where you can't come back.
You can't come back.
And
There's
then
no way you can regenerate nothing.
right. Yeah, and you're not going to install DNA that's not yours because that's not going to work either. So I totally get that too. You
Yeah.
know.
And what if that DNA is supposed to be like a hair follicle? Now you're
Mm.
growing hair inside your knee or something. I don't know what's going to happen because those genes are going to make something from something. You just don't
Yeah.
know the code.
Yeah, let me tell you something. There, I mean, we live in a world today where like they were doing a polio vaccine in Africa that ended up giving people polio because they messed up the whatever. You know what I'm saying? And that's a whole nother subject. But
That's a whole nother subject right
it
there.
is, and
I
I'm just
I remember that
fascinated.
vaccines when I was growing up.
Yeah. Yeah, well, when we grew up, there were three on the schedule, right? There was MMR or whatever, and this and that, and then there were, and then there was as many as 72, then there's 25, and now I think there's like 12. Yeah, and again, let me tell you something. I'd like to do a table discussion because I know I have friends, and we could have this great conversations on vaccines compared to gene therapies, compared to what's necessary for a kid like Hep B or whatever, and this and that, and what it actually does. And I like to have those conversations because when you have those conversations with people who, I'm not going to say who have a conflict of interest, but who have nothing to gain, or, you know what I'm saying? Like nothing to gain and everything to lose, except to tell the truth, right? Because it's not about knowledge. It's about the balls to have an opinion and then debate those issues, right? Because I think in our climate, I think we've lost that. My boss, my old boss, this is my guy, Dr. Rosenfeld. This is the last book he wrote before he passed away. It's called Doctor of the Heart. But he wrote a book called Second Opinion, right? And there was a perfectly healthy guy that had an abnormal ECG, right? And his doctor was saying he had a bad heart. So he sold his business. We wanted to retire early and, do things that were better for his heart. And my boss said, look, an abnormal ECG means that you just have an ECG that's not normal. It doesn't mean that there's something wrong with your heart. It just means your ECG doesn't fall under the criteria of what the normal a normal electrocardiogram. Sorry guys, ECG. We're military people. We're in acronym hell right now, right? Yeah, electrocardiogram, right? So it's really about doctors getting together and guys like you getting together, because you're once again, for the second time to my memory, you're at the front line of technology that's growing, right? Because you were one of the first cryo guys, right? You know what I'm saying? Which well, I'm more than willing to get into next when we talk about that. But I think my point is, it shouldn't have to be an extreme situation for someone to seek a second opinion. Right? Like if you have an infection in your leg and the first doctor says you have to amputate it, you're probably going to get a second opinion, right? You're not just going to trust the first doctor and say, there's a knife, give me the chop. Don't need painkillers, right? I like the pain. No, right? You're a football guy. Remember Alex Smith?
Alex Smith, yeah, the quarterback.
Yeah. His first doctor said his leg had to be amputated. His second doctor says, let's treat it with antibiotics, let it run its course and see what happens. And as a result, saved his leg, had both legs, got back in the NFL, right? He didn't perform to his standards because when you lose those years, the years, you know what I'm saying? You'd have to be quite the athlete to just come back like Phil Rivers, right? Who, by the way, I thought still threw really well. I don't know if you saw Phil Rivers come back, but he came back and joined the Indianapolis Colts at 45.
Yeah, he was awesome.
But watching Alex get back on the field, walking and throwing footballs instead of being wheeled out to a round of applause was the common denominator of a second opinion. Is there anything you'd like to say about this before I drive us too far off the cliff?
Okay. So I'm still in practice right now, and believe it or not, my office, that's pretty much our theme right there. We're the second, third opinion. I love I love difficult conditions, some type of like that PTs, chiros, orthos have a failure, they come see me. I want to see that type of patient. So I'm that kind of world about the second, third opinion. So it's interesting that how there's a standard procedure for like an Achilles tendonitis or something that has a protocol that says, all right, you do these steps and then you can do these therapies and then you should be back, right? It's a cookie cutter kind of therapy. Well, they don't understand that everybody's different. Everybody is aged. There's some issue that they may be different from the other person. So when you come to my office and you have an Achilles tendonitis, we're not going to treat you just like the old, hey, let me take out this card and follow these steps for the therapy. You look at it, you analyze, you see what they have, and you break it down, and then you work on that specific individual with their unique anatomy, and then you work around that. So you have to find that special doctor. I'm a sports guy. I'm not a visceral guy. I'm not a cardiologist or anything, but if you really want to see the soft tissue around a joint and you really want to know about the biomechanics, come see me. That's the stuff I love. I see bad post-op stuff. I see people that want to do surgery, but they're like, hey, I better get a second opinion before I go in that world. Those are the things that we love here. We love that kind of stuff. Anything that said, my doctor don't know what this is. I don't know what that's that. Those are the things. So absolutely, second opinions is a must. You have to get all the information in there as possible. And don't be afraid to even go outside of the medical and the doctor world. There's AI, there's chat. Find out about it. Question your doctor by not just like asking, but check on this information. See, he goes, what does that mean with a thoracic outlet syndrome? Does he know about this anatomy that really caused that? Or is there like a sciatic issue? Where is that caught at? Is it caught in the piriformis in the lumbar region? Is it maybe behind the knee, maybe the head of the fib? You have to find exactly what he's talking about and see if he's correct. And if he's correct, and then you're both, going back to the mental side of things, when you're on his side because you trust him, the procedure is okay, but the actual recovery speeds up faster because now you're working as a team. If you don't have that mindset, if you don't trust your provider or doctor, and he's like, I don't like him because of this, you're going to have a poor outcome. It's going to be tough because you're like already mentally already degrading his theory based on something, so that's why a second opinion, if you don't trust the first one, continue on, move, and then you'll find your answer. And it could be from any source, a doctor, a friend that may lead you to the right source, and then you do your own homework. You'll get the information, and then once you get your confidence, then continue on from that point on until you get that confidence and you assure that you have the right person that's on your team. Keep moving.
You know, I also think, because I've done a little bit of research on you. I don't just have you come on the podcast and be like, chillax, man. Uh, um, you have a knack of making your patients not just comfortable, but brave to talk about issues that they're not completely knowledgeable about, right? Like the person who knows how to fix themselves more than the medical professional is always going to be the patient. They just don't know how. They don't know what it's called, right? Like, uh, um, I remember comedian Joey Diaz. He's good at remembering people, but not names, right? So he'd be like, "Who's that guy with the one testicle riding riding the freaking bike? Well, what's his name? Armstrong, that guy, right?" So, right, pretty good impression, right?
Yeah, yeah, it was good.
Who's the
You
guy
had it all
with the one testicle? Uh, um, I you make patients comfortable enough to talk, and the more they talk, the more you understand them, and the more you understand, the more you know what hurts and what needs to be fixed, right? Again, going back to my boss, Dr. Roosevelt wrote another book called Symptoms, right? And he started the book. He said he asked 6 patients, "Have you had any gribbling?" Right? And one person said, "Not since I had my prostate fixed," and which is not gribbling. I think that's dribbling, right? Um, and he got like 5 different answers, right? And the fact of the matter is, he made the term up. He just wanted to see what the patients would say, right? And the 6th patient, the honest one, says, "I don't know what the hell you're talking about," right?
Yeah, yeah.
So I think if you have patients that you don't make them feel like an idiot because they don't understand the term, even though they understand the symptoms and they understand the pain and what they're feeling, the more that you can have an open communication, and you kind of dot your I's better and cross your T's better, where you don't have to come back at something that you may have missed.
Yeah. I think the big thing with that is that listening. I ask questions and I just listen. And then if you do a good listening route, it tells you exactly what's going on. You just listen to them. And then when you go to the next step, I love this part, the communication. And then when I see a patient communicating, but more so teaching and getting an understanding about their condition based on starting point, anatomy, the structure, and then some of the compromising things that are going on to create that injury. Once they understand that and then they really have a grasp of what's going on, then they understand what's the next step. Then here comes the protocol, the procedures, the therapy, and all that. It seems so simple when you have a good foundation of understanding what you have. Or instead of saying, all right, you got tendonitis, we got to do this. Instead of saying, all right, you have a short belly of the muscle and is making too much tension on the distal end where the tendons attached to the bone. When the muscle is tight and you try to do a lengthening thing, well, the only thing is giving up is the tendon, and the tendon becomes compromised. So we have to relax the belly of the muscle to get that natural tension throughout the whole fascia and that muscle tendon bone junction. And now you're able to do things without it being utilized too much in that tendon side. So once you get them understanding that, then you say, okay, what's next? Then they know, it goes, okay, I need to do this particular therapy. I need to do that. And then it all makes sense. So it's about really communicating and educating and get into their self to be where it's on the same level of what you're trying to do.
Do you hear that, patients? Where's my camera? That's right. You have the power, but one must participate in one's own salvation. Do a little research on these terminologies. Doing your own research back in our day was called reading, right? Yeah. And I do like that because again, I'm more of a proponent of not residual treatment for the rest of your life, not having to pay for drugs for the rest of your life. Like dying in America is the most expensive thing you'll do in this country. Not putting your kids through school, not paying off college loans, not having a job where you're living check to check. Um, Dying in America. That's it, right? And me personally, I'm not on any medication. I don't take drugs for anything. My boss, going back to him 3 times now. Now you got to look up the name Dr. Rosenfeld when you get off this. Wrote a book called Doctor, What Should I Eat, which prescribed a lot of foods for ailments instead of medications. And at the time I was 260 pounds. I actually lost 65 pounds, and I was like 2002, and here I am. I don't look 55, right? I look like a creepy 35. So. Um, and we're doing well. And dude, you're like Asian, so I mean, yeah. I don't want to
I'm
sound.
like 95,
I was
man.
gonna say I don't want to sound racist, but I've never met a middle-aged race Asian. They're young, and then one day they're old. I've never in my life met a middle-aged Asian.
I'm a little ahead of you. I'm at 58 now, so
58.
I'm getting there.
See what I'm saying? You even look younger than me, right? And I'm 3 years younger than you, and I think look, the proof is in the pudding, right? The
Yeah,
proof is in the
definitely.
pudding.
I
Uh,
like that you said that um, you know, medication, right? So when I was growing up, my dad's a surgeon, and interesting about that is that I was never given anything as far as like, like a drug or something that really like, like you got a stomach ache, you got a headache. I don't remember aspirin. I don't mean, I remember even, like when we were kids, we get stitches and stuff like that, right?
mhm.
So I remember my dad just stitching me out with no anesthesia. He goes, "Hey, you want to fight? You want to?" He'll just stitch up my hand, just stitch up my arm. He goes, and that's how I grew up. So it's like it's a good transition from that world, thinking like, well, if my dad doesn't really push that stuff on me, why am I going to go on the medical side of this? That's why I went to the non-invasive, non-pharmaceutical route with chiropractic. If you get your body in the right environment, it can do wonderful things. You just have to be in that environment. Food, environment and the actual, where you're at. Stay away from like toxicity stuff. You can get into that well world of that blue zone, 100-year-old person. So
Yeah.
it's that start point for my parents.
My previous guest sees a naturopathic doctor, um, and I said, but at some point you're going to say not anymore. Because one of the things about homeopathic and naturopathic doctors or other specialists is if they do their job, you don't need to see them again because they've already given you a schedule in accordance to whatever, like a glycemic chart index and this and that. And one of them was like, "Yeah, the sad thing is, like, some people's doctors, they have a patient for like 30 years. Like me, if I do my job, they'll never see me again." And I think there should be more of that, because if there's more of that, then that means we collectively are doing something right. Not just the practitioner, but the person who I said must be a participant in their own salvation, right?
Absolutely.
I
It's
mean,
you.
I'm in a medical practice, and I'm like, do you want to be on a diet that lowers cholesterol, or are you just like, doc, just give me the Lipitor. Just give me the drugs, please. You know what I'm saying? So, some good doctors, they measure that too. They're like, no, this is a patient that wants to do the right thing. I'm going to help them this way, right? This is someone who just wants the drugs. Fine. That's what the drugs are here for. And I'm in the practice of medicine. So boom, do that too. So, some of the best doctors I met are very good at balancing
Yeah.
those things.
Yeah. I think like going back to
Mm,
the education component of it,
yeah.
a lot of patients, especially when you think about like diabetes, a huge condition out there, type 2,
Yeah.
right? You look at that, there's a simple cure for that, believe it or not, and it's just exercise. Burn the sugar that's in your bloodstream. Sure, you may have an insulin resistance, you may have something that's not allowing you to connect that, insulin to the glucose and pull it out of your bloodstream into some type of like, fat or muscle. But if you have that viscosity being thickened by glucose and you start getting a neuropathy because you're getting the poor blood flow, you can't get to that distal end where the nerve endings are at. If you exercise, well, our body uses glucose for like a gasoline, like energy, right? The first thing it does, it wastes the sugar in the blood, the glucose in the blood. It'll bring your blood sugar down real fast. So, type 2 diabetes, it's the simplest thing. Go for a little walk. Try to get to 10,000 steps a day, and then you'll be able to manage that diabetes real easy. Walk after you eat. Don't sit around. Those are the simplest thing, but nobody wants to do. They want to say, "Hey, give me a drug. I need it. Give me something to increase my insulin. Give me something." I said, "Oh, look at
Sure.
that." So but those are
Mm.
things, if you educate them and they'll look at you like shocked, goes, nobody ever told me that. It's like, it's the weirdest thing. Like, I know it's out there. Going back to the message, right? You're
Mhm.
looking at people that hear information at 10,000 ways. And then through our conversation, that one person say, huh, exercise will get rid of that sugar in my blood. My diabetes will get reduced and my A1C get reduced from just walking. Yeah, but he probably heard it 10,000 different ways, but maybe this one way it connected with him. So that's why I always say that education, I try to teach people, each patient that comes to my office about their issue. And I say, hey, look at what you have. Here's the foundational stuff. And then take the information, do, like you said, some people just don't want to hear that. I just fix me, right? And like, okay, then through the procedure, I try to re-entertain that educational component because it's very important for these people to understand that, you know how to drive a car, but don't you want to know how the engine works? Don't you know a piston, the carburetor? You want to know the fuel injection. You kind of want to just have a general idea of this stuff. So you know that if something happens, you're kind of like isolating okay, I know it's got to be this part, and maybe you're right, maybe you're wrong, but at least you're kind of like going in that world of investigating.
Well, I think it's in our nature as human beings to have education through self-correction, right? It's weird that like the whole flooding thing I was telling you about, like my washer hose, I tried to just connect it
Oh
and
yeah.
reconnect it and didn't know where the switch to turn the house, like the water in the house off. This is still a relatively new house. I had no idea where it was. But I tell you what, I know now. I know where it is now, and from now to the day I die, I'll never forget what now. So I think it's happening in twofold: self-correction, mistake, an engine breaking down, knowing that's going to cost you a lot of money. All of a sudden, you're curious. Now, all of a sudden, you're going to see how the engine works, right? Uh, um, so it's education through self-correction, but also it's like foundationally, it's an inciting incident that makes you, that just kind of puts you, you've always been here, but the thing that there's something that has to happen to put you over the top, right? Like when I was 265 pounds, right, my inciting incident was I was on a New York train station, and there was a guy sitting across from me in the little two-seater, and he looked, the hair looked like me, face looked like me, very similar features, except he was like 350 pounds, like took up both seats. And he had McDonald's, like he had a 20-piece chicken McNugget. And he had his food and he wanted to eat on the train. He had no place to put the McNuggets. He looked at his stomach, put it on his stomach, and was just eating chicken McNuggets off his stomach. So while he's doing this, I'm like, wow. That was it. That was my inciting incident. That was like, this can't stay the same, or I'm gonna be that, right? And I don't mean to have inciting incidents sound like a scared straight program. This is, but very similar. But I'm not doing that. But I think the reason why you and I witness these transformations, it's usually self-correction from mistake, or there's something that happened that said this can't stay the same. So
Yeah, that's
um,
very pronounced about you and the reflection of a future you. You're looking at yourself like I've got to make. So I always say there's always going to be forks in the road, always forks in the road. And if you go back in time and you think about all those decisions you made, and you think about what was the other decision that I didn't take and then would have been better. So that was a fork in the road. That was basically say, hey, continue on. You're going to see that person in the mirror, or take the other path, which is harder, difficult, but rewarding in the long run. And my game is always a long play. It's always a long game. Everybody wants that instantaneous, hey, I want to win, win, win right now. And it's like,
hmm,
yeah, it's good, but that's what I think sports, sports does a lot of that great instilling, like understanding that you might not win in these little workouts. You can't do like if you want to like do, let's say you're a jumper, you want to get to like 35-inch vertical, 40-inch vertical, and you're at 20 inches. You're not going to get to that level right away, right? You do these micro wins, you work on it, you work on it, and work, and you start seeing little increases. You may have a setback, but you don't say, "Hey, I quit now." You're going to continue on, and through that process, it drills that hard condition that you can do anything for those little micro wins and the micro processes. And then you take that into the future where we're not an athlete anymore, but we're doing like life, projects and stuff like that. We know that just stick to it, just continue on. And I think we have, as athletes, we have the luxury of doing that, of pushing ourselves and understanding there's no wins right now. There's wins later, but let's just continue on and then work our way into that realm. So sports, like I said, sports is huge, military is huge. Those things are really impactful when you look at where, we are right now and how we drive ourselves and how we continue on. So it's one of those things that I think a lot. And I don't really remember like our hard practices, our hard workouts, and all that stuff. Maybe it's one of those defense mechanisms I have, but I'm like, I really enjoy this other side of it, like where I'm at now. But if you look back really hard, we went through a lot, right? All the trainings, all the hard works, all the sweat, all the I can't go take an extra lap. And then you just understand that character building became that future tense person.
Yeah, like working with the Tampa Bay Buccaneers, right? You have people that already went through, like, I guess the junior system, high school, college, and they're now professionals. And I guess they have a lot of food on their plate, but at the same time, they're trying to take care of their bodies too. So, working with a lot of these athletes, was it easier because they know the drill?
Yeah. Interesting about that is that pros, collegiate, high school, middle school, it's almost the same person. It's just that they have more education. They have, of course, they have their talent, but when you look at their mindset, you have that one that's just pure talent. Pure talent, no effort, can do anything. You got that group. Then you got the opposite of like there's that limiting factor of they don't have that talent, but they have the hard work ethics. They are the trainers. They just outwork everybody else and they become that person. So you have those two groups. So the ones that really work hard are that type of person you want to work with. Now, the third person is a combination of those two, talented and a hard, ethical, hard-working person. That is when you're looking at the elite of the elite. That's when you know, goes, wow, you just surpass everybody because you just have the two talents as one. So those are the kinds of guys that they're enjoyable to work with because you talk to them, they do their homework. A lot of athletes at this level, they know what's going on. They may act like they don't know. Like I always talk to my other doctor, that works with pro athletes, and they talked about their patients or their athlete, and I said, he's fooling you. These athletes know. You think that these athletes, they're out there testing you to see your knowledge because they want to know that are you able to understand about basic principle, anatomy, physiology, and then they want to see your caliber of education. So if I allow my body in your hands, am I going to trust you? So these guys are very educated in the pro worlds. The neat thing about that is that they had to go through that process. Middle school, high school, college, and then where they're at now. So they've been through many doctors and then they start questioning and then they figure out, hey, I heard that before. That's a scam. This works. And then who are you and all those things that need to be, gone through the process to be that level. So it's enjoyable when someone's really on your side and as a patient, and then you tell them to do something and they do exactly what you say to do. And the progression is so much easier, so much faster, so much like in tune because I know what the body needs to do. It's just that it's only 5%. The 95% comes from the athlete because they're the ones that have to go through the pain. From a post-op world, the worst thing you want to do is bend your knee, because you just got a surgery for like maybe an ACL, but we got to get the inflammation out. You got to get the fluid out. How do you get it out? You've got to bend the knee. You've got to work it. You've got to flush that fluid out, and it's painful, but we've got to move it. There's not going to be more tissue going to be compromised when you start looking at inflammation, but the pain is so increased because you got so much excess fluid that you're not really looking at the compromise or the surgical site. You're looking at the inflammatory world giving you the pain. So once they understand that, they push through, and then the recovery is much faster. So that's what the big thing is.
Yeah, and you'll never be out of work because there are people that are having ailments and pain that fall direct, not indirectly, no, directly, like a shoot into your wheelhouse in what you do best. As you know, I'm a volleyball coach and commentator. I took the year off from coaching. I was just having fun traveling around, just calling matches and emceeing. I wanted to do, I had some bucket list items like Hawaii, Honolulu. There was a juniors festival out there. Aspen, I go every year. Seaside, Oregon. That was the first time I was out there. It was nostalgic. So and I, of course, just like you, like let's say you're taking time away from your practice, there are always people that are going to call you, be like, can you just see me privately? So coaching, I do have private lessons because if you're as good as you think you are, the work keeps coming to you, and it's a testament, right, to the hard work and dues you paid or we paid and this and that. And I wanted to talk a little bit how your work applies to juniors, but I have a quick question before that. Do you have nervous energy sometimes where an athlete does everything you say and it still doesn't work? Like I'll give you an example. Matt Taibbi, he's a journalist, or some would consider a journalist, some wouldn't. Um, Not everybody's favorite person, but he's really good at calling balls and strikes. He said every time he did a report or did a story, and he submitted a story, he did not sleep. He's up all night because he's 90% sure that he got the story wrong. And the thing that made him a good journalist was he didn't operate under the presumption that the story was wrong, but he had this overwhelming a fear of failing at telling the story, right? Because you could have a 5-page story and like there'd be one mistake and everyone's going to judge you by the whole mistake, the one mistake, and throw away all the great work you did around that. So my question to you is: are there ever instances where you're like, I know science guys like you are not in the business of clinging to hope, just evidence. But you ever have some nights you're like, man, I hope I'm right.
You know,
This is
Jake,
a very very vulnerable question, which we
yeah.
can skip if you want,
No, no,
for
no. I love this
liability
question.
purposes.
Well, here's the thing. I'm not saying that I'm the perfect doctor out there. I'm not saying any of that. But if you do your homework and you know just understanding about the fundamentals of anatomy, physiology, and the structure, you start with that. Then you start going into what are you have to first do a lot of homework in the sense that do a good examination, initial examination, is find out what am I working with. The knee has structures in there, and then you got to find out exactly what structure is compromised. Is it a complexity of three, one, two? So once you identify by motion palpation, palpating, maybe some like like muscle testing, you're going to have to figure out what is compromised. Then you do right when you get to that area where you think that's the problem. Then you do a secondary test just to confirm that. You want to keep backing up, backing up, back. I think this is where the military got me, is that you can't go on your first instinct. You want to make sure you have a concurring information that backs up what your primary. So in our world, there's a diagnosis and a differential diagnosis. So we have like a probably like in my head, I probably got like 50 kind of like diagnosis of that particular area.
Yeah.
So once I start identifying the structure, I can knock out some of those differential diagnoses, right? So now I'm down from like 50 to like 40. Now I do some orthopedic tests. Now I'm knocking them down. Now I'm starting to funnel down to the last five, four. Now, if I don't feel that I know exactly what's going on, then I'm gonna do a diagnostic, like X-ray, MRI, ultrasound to really pinpoint that compromised tissue. So once I know exactly what tissue, what structure, what I'm gonna deal with, and then the syndrome is easily diagnosed from that point on, now the pathway is getting better. Now I'm sure what I have. Now the course of action, if it's a tendon, well, a tendon takes longer time to heal because it's not vascular like a muscle. If it's cartilage, likewise, right? So when you look at the avascular structure versus a muscle, well, you know your time frame is going to be delayed or sped up because a muscle has so many capillaries, so many blood flow, it heals faster. Then you got to think like, what happened to that structure? Is there something impinging? Is it a nerve impingement? Is there something inhibiting the action? Is there something in the way? Is it one of those things that you have like a bursitis that is kind of like jamming underneath the shoulder? This thing called a chromium, and getting you this thing called a subacromial bursitis. Is it that? Then you have to think about what's the next thing you have to work on. Well, it's the articulation of the joint. So it's a whole dynamic of just starting off with the educating what's going on, then moving on to what you think it is, and then clearing out, testing out, is it that? No, is it that? You want to get rid of all the no's, and what you have left is the possibilities. From there, clear it up with some diagnostic tools. Once you get to that point, now you got it. Now it's about treating it. What is it? Is it inflammatory? Is it a tear? If it's inflammatory, you got to reduce the inflammation. What do you have for reducing it? You have to vasodilate the small vessels to get that interstitial fluid out of there. You have to think about if it's a tear, well, now you have to bring in more type of building blocks to heal that particular area to figure out what's going on. If it's a capsulitis or scar tissue, well, then you know what you got to do. You got to get aggressive. You got to break up that scar tissue. And then you have to combat, once you do the scar tissue breaking up, you got to combat the inflammatory world. So it's a balance. So I that question you asked me, in my side of me with all those years, I'm pretty confident and I don't really sit back and like think like did I screw up? Because I knocked out everything I could to possibly like eliminate all the problems. Like the worst kind of doctor you want to get around with, he you come in the office and goes, I know what it is, done, boom, and then you're out. Like, whoa, you're sitting there goes, that was 5 minutes and you didn't even touch me. That's not who you want to deal with. You want to deal with someone that get their hands on you, move you around, do something to figure out, okay, even in this day, my, 20 years plus with sports, elite athletes down to the civilians and the weekend warriors, I still have to question, goes, am I still able to look at somebody? No way. I need to get my hands on somebody. I need to palpate. I need to do my orthopedics. I need to do everything I did from day one that I'm doing now. And that's why I feel that that question is um, that sleepless night, rarely. I really think rarely. Do I have some difficult patients? Absolutely. But I'm still in the process of going to that diagnostic checkoff list. I'm still in that process. And I'll get to that point. And have I ever got it wrong? Absolutely. But I'm sure close to it. And maybe I switch gears. But at least I'm honest about it. And I tell them, all right, it was this. It wasn't this. It's that. So then we'll go that way. So there's not that type of like scenario where, oh my God, did I do something wrong? Did I screw up? So no, not in my case. I don't want to feel like I'm a superhero, but I just think I just do so much homework and then make sure that there's clarity in what I'm trying to deal with.
Well, I definitely appreciate that. That's why it was a loaded question, right? Because in the medical practice, and in a legal practice, right? There's I just saw a podcast with Aaron Siri, an attorney, and he says if I go to court, I have to present evidence, or the judge is going to laugh me out of court, right? So so it just comes from years of experience too, right? Not just understanding how the body works, but like uh, um how we learn about things, like um I don't want to bring nutrition into it because nutrition has to be the worst thing learned and taught in the United States. We can't even get eggs right, right? In the 80s, in the 80s, oh, eggs are bad for you. In the 90s, oh, eggs are good for you, but it's just the whites. And now it's just eggs, right? They can't even get that right. Our breakfast chart, like the top of our breakfast index was frosted mini wheats, which is basically sugar on top of whole grain, right? I mean, man, just admit they don't teach nutrition in medical school, and read up on it, man. You know what I'm saying? So I'm just making a personal joke before we jump to the junior scene. Um, I'm lucky to have an expert to ask this question. What do you tell juniors? Let's just say I'm a volleyball coach. I'm a club coach. I've done that for a little bit too. It's pretty good clubs too. And I sound like club you've ever seen. A great club, a beautiful club. What are some of the preventative things that you can tell some of the juniors that prevent something we affectionately refer to as wear and tear, right? Like, for example, when I played, they taught me how to jump, but they didn't teach me how to land, right? And this is why we were having this conversation about my knee and cartilage to begin with, right? So what are some of the tips? Because I know you've also treated AVP players too, or worked with AVP players, which in my wheelhouse, I coached two guys on the tour too. So, yeah, let's talk about juniors. Let's talk about preventative maintenance a little bit, if I ask
So
that question right.
yeah, so let's say it's juniors, like pre 12 years old, right? And you're looking at those young kids, you start with the flexibility. You've got to get the flexibility. The problem once they hit that 12 and they hit that growth spurt that they're about to hit, bones grow faster than muscle. So then you start thinking about that. You get the tightness, and then because the bone grew so fast, you start getting that typical thing on the kneecap or the patella tendon, what's called the osculus slaughters, right? So the big thing that I tell these kids when they start going off, you got to get a good habit of stretching, elongating these tissues. You know, it's about this connective tissue around the joint. And then the next component is strengthening. You've got to have the stability to keep that joint in place. So those are the big things. The problem is that when you're like, at a younger age, it's hard to develop that type of big muscle, when you're pre 12 years old. But afterwards, you can do that. But the thing is that you need to learn about the proprioception. Where are you in space? Are you in the air? Is your foot dorsiflex, plantarflex? Are you landing on the tips of your toes? Are you landing on the ball of your feet? So those biomechanics at the end stage, which is the eccentric component, where you're the landing component, that's where most of the injuries occur. Not so much as you do the concentric coming up, jumping up, right? So those are the things that you want to think about when you look at the normal tissue versus the elongation of the bone. You've got to do the one-to-one ratio. So that's why flexibility is important. Keep stretching out. Learn at an early age what stretching out is about because it's not enjoyable. Nobody wants to do it, but it's preventing. So if you see someone that wants to just play and just go cold turkey and then you can get away with it for a period of time. It's going to catch up to everybody. You know that, right? You just don't warm up. You start playing at max speed, you're going to do something bad, right? So I look at like our body like a tent. You got the front side, the back side, and the side. It's gotta like keep this post at a straight level. If the front body, like the hip flexors, is too tight, it's gonna pull the pole forward. That means your back side, the posterior side, has got to pull back more. So now you have two tight muscles. Well, if you solve the front first with stretching it out, getting that elongated, the back doesn't have to be tight to combat that. So you want that synergy. You want that perfect homeostasis. So that's why flexibility at an early stage, starting point, get that going. Once you get that going, now they can handle that kind of elongation, compression. Now you work on the stability. Now you look at the strengthening. And then next thing you want to do is really get them involved with proprioception, where they're in space. The worst thing to do is jump up there and kind of just flail around, just kind of land where you want to land. You want to know exactly where you land. You want to know where your leg is at. So there's a lot of great drills out there to teach people, how to land on two legs, one leg. How do I go 1, 2 real quick? So you're taking a little load on the first leg, but you then quickly shift it to the other leg. There's a lot of training methods of that, but it starts with flexibility. Then I really feel that the strength and then the proprioception of where you're at in space is important. Then you can go into the technique component of it. But you know how that goes. You're trying to do a lot with a short amount of time, so you're trying to, maybe compound all exercises to one exercise. So, but going back to the big suggestion for these young athletes, stretch, flexibility. Get that flexibility, frontwards, sideways, backwards, all that stuff on your hips, shoulders, everything. Get that flexibility.
I couldn't agree more. And it's wild because I think the value of actually stretching has where people are doing more dynamic warm ups and this and that. And I'm not saying correlation's causation, but it seems like we're advancing in exercise science and this and that. And it seems like we have more injuries now than we did before. and and I don't devalue the advancement in science in these things, but I think on this journey there's a stop someone missed, because my observation, and again, correlation is not causation. I'm not saying it's not doing this is causing that. I don't. That's not my wheelhouse. That's yours. I do a lot of research because as a coach, there's no way you can't coach for 26 years at every level, right? And not understand how some of this works. But when it breaches expertise, of course, appealing to authority is not a fallacy, but an imperative. Okay, so I totally get what you're saying. Um, let's have a little fun. What's the last book you read? He's
I
like, who
wish
has
you didn't
time to
ask me this
read, Jay?
question.
Who has time to read, Jay? Look, when you come to
I don't know.
California, you got to see me anyway, man. I got to show you my knee. I got to show you. I got to
Something.
show. I got to
I
show.
think the last thing
I got to show you that little bone on bone thing
hey,
that
that
you can even
BMO looks
see in the
pretty nice
camera,
too.
huh?
That BMO looks pretty nice right
Yes,
there.
yeah, man. I trust me. I've been taking care of myself since I dropped the weight. I've understood my body on this level that I feel like I'm reversing my age process. I look. I'm gonna show you a picture 10 years ago, and you see me now. It's ridiculous. I don't know what's happening, but if I'm doing it and if it works for you, I'm gonna do it again.
Yeah, you're doing a great job. I mean,
Yeah,
I think the big secret is that, the physical activity,
yeah,
being positive. You got to have the mind and the body work together, of course.
right.
And then, what you put in your body and then being active. I mean,
I'll,
that's huge.
I'll recommend The Winning Element if you have time to read something on the plane. It was written by one of my previous guests, and talks about winning the battle on the court and off the court. Her name is Deanna Schneier. She's a referee, but she's a longtime coach and a Division I player at some school in Texas. Might have been A&M, which by the way is savage now, right? They're the reigning defending champs now, right? Yeah. I don't know what happened between Texas and California, but there's a huge hostile takeover for indoor women's volleyball. It really is. Some guy with a cowboy hat came up to me one time at Nationals and he said, son, sometimes the best way to beat a good old boys club is to make your own. And I was like, can't mess with that. So it's called The Winning Element. And I'll send you the information. But while we're talking about all those other things, if you have a copy of your book, I just want you to flash it next to you. Do you have it next to you? Or
No, I don't
yeah.
have it next to me, but
No, I could green
if
screen
you,
it on the edit later. I
yeah,
know what
if
it
you can
looks like.
pan
Yeah, yeah.
you
Let's
can
do it.
see
Let's
my
go
book on
full
the
screen to
wall.
you. Boom. There it is.
Here,
Okay.
let me kind of move that camera over there.
Ah, there it is. Look at that. Regenerative medicine. Are you kidding? You are an athlete's wild dream. Just the book alone. Look at all the molecules, the atoms, or whatever the hell you call those things. Cool, man. Um, who's your favorite comedian, or who do you like for comedy?
I don't know. I mean, they're all pretty funny. I mean, that's a good question. I don't know. I don't. I think everybody's funny.
I like Bill Burr. Well, Chappelle's is like the king to me, but I'm an old school guy. I grew up watching Richard Pryor.
Yeah, Eddie Murphy, all
Eddie
those guys.
Murphy, Delirious. I think he was a last minute sub for John Belushi, who unalived himself. Um, and
Remember the Saturday Night Live skits?
Mr. Robinson's Neighborhood, something
I'm
like
Gumby,
that.
damn. How about I'm Gumby, damn it? Remember that one?
Ah! What's a last good movie or TV show you watched?
And here's the thing: I don't watch TV. I don't watch the news.
Yeah,
I think the last thing I saw was in the movie was Top Gun Maverick. That was the last thing I saw.
good movie, good choice. Yeah, yeah. I think I saw Avatar with my kid. At home a little bit. She wants to catch up on all the avatars before she sees the third one. I got a 9-year-old, but
Wait a minute, did you say a third one? There's two after the first one?
I guess there was a something water, and there's one in the theater right now. Yeah,
Hey, I'm so out of it
um,
right now. I'm just so deep in my world of like
yeah.
researching, and this is my fun.
Well, I am
I
too, but I would suggest to you, from a psychological perspective, that everybody has an escapism that allows them to come back and do their job like a mammal,
yeah.
right? Because at the end of the day, the job can't save you. For me, volleyball was my escapism, but when it became my career, I sing karaoke twice a week.
That's cool.
Yeah, so, and I always tell my volleyball players this. I have volleyball guests, and I'm like, you're 24/7 this, but it can't save you. And at the end of the day, it's the next case, it's the next patient and the next patient. But at the end of the day, not if, but when the dust settles, what is there? There's these other things that allowed you to escape to come back and do your job like a mammal. Right? I'm gonna look at my camera. Do you know what a mammal is? That walks on two legs and drinks water. Vodka, tequila, or bourbon?
Back in my days when I used to drink, it was vodka, but I don't drink anymore. It's
Yeah.
been about 11 years now.
I'm a vodka guy, but I'm kind of with you. I'm kind of with you. You know, I live in a happy hour house, but my wife likes wine, so I guess I do too. You know, and we, you know, our choices are, yeah,
Surprised about that one.
yeah. No, but vodka. I'm a guy from Brooklyn. I went to high school with the Russians in Brighton Beach, John Dewey. So,
Yeah.
and we drink they start at a very early age. Who was your favorite action film star growing up? Because I know you watched TV as a kid.
Well, in the movie world, it's always gonna be Tom Cruise. I mean, Tom. Here's a funny thing. So that movie Top Gun, the original,
Mm-hmm.
high school. I graduated '86, and I went to Navy, and lo and behold, I'm in the Navy world, and I'm flying in jets. I'm in the backseat of a jet, so I'm like, this is the weirdest thing in the world here. I don't know what it is, but I'm kind of like in a movie set right now, just flying around, having a good time, doing missions out there in the deployment world and all that. So it's pretty cool.
Wait a minute. That was your MOS?
I was a what they call it. So I was an AW, an anti-submarine warfare operator, on the S3 jet. So I was in the back seat of a S3 Viking flying around. I did 66 catapults off a carrier. Did some crazy missions in the Pacific, in the Northern Pacific, Aleutian Islands. Oh, I had a great time.
Wow, dude, you must have murdered it on the ASVAB. Like, sorry guys, people at home, ASVAB is an army entrance exam. They want to see how smart or dumb you are, and the smarter you are, the more they sit down and try to sway you into job opportunities
They
that fit your intellectual, your mental acumen.
Hey, they wanted me in nuclear. I said, what is that? He goes, well, you get to go work on a nuclear powered vessels. I said, like a submarine? I said, no, I'm not doing that. No way, man.
No.
So then they say, well, what do you want to do? He goes, I pretty much had any job I wanted. I goes, I don't know. I mean, I want to have fun. He goes, you like swimming? You like working out? He goes, I love running. I love it all. Yeah. He goes, okay, take this. So it went down the pathway that S3, because you have to go through aviation training and all that flight crew and all that stuff. So it was, if you ever watched the movie way back then, it was called, what's that? Uh, uh, golly, with Richard Gere. What was that one with the
Oh, officer and a gentleman.
officer and the gentleman? It was just like that. It had every type
Officer
of
candidate
training.
mayonnaise.
Yeah. I know where to go.
Only two things come from Texas: stairs and queers, right?
I don't see no horns on you.
Oh man, it's he won Best Supporting Actor for that. And he
Yeah.
deserved it. Louis Gossett Jr. Man,
Hey,
Brooklyn guy.
mayonnaise did good. He did
Yeah,
good.
Brooklyn guy, by the way. Yeah, and listen, for people that are joining the army, you're gonna have some good recruiters and some shrewd recruiters, right? And some okay recruiters. But the ASVAB advisor guy, those dudes are awesome. Because when I took mine, I scored high too, and they said, "What do you think your interest might be?" And I'm like, "My mom wants me to be an accountant." So, to do finance in the army, you have to enlist a minimum of 5 years. And I wasn't interested in being in the army for 5 years. I wanted to do 3 or 4. So I'm like, "What else are you selling?" And he's like, "All kinds of ash, you know." So he shows me this video where like you're at this site and like all the lights go out, right? And then like three soldiers come in, right? Two of them have like a weapon, but one of them has like a toolbox. They come, they fix the generator, like all the lights come back on. It's like a be all you can be commercial, and I'm like, I want to do that. So I was a diesel generator mechanic. So
Okay.
I did boot camp at Fort Knox. I did AIT at Fort Belvoir, which is where all the generals stay. And I learned about small engine repair, electronic maintenance, and diesel generators. It was like a 4 month class. Like picture all you're doing is from 9 to 5 with an hour and a half lunch break every day for 4 months, which is equivalent to 4 years of college, right? But without the electives, just about that life, and smart bunch of guys, man. Like I graduated with a 92 average, and that was next to last in my class. you know, I dropped down because one of the multiple choice questions, I skipped an answer, so all of my answers after that were wrong. So, I basically had this extremely low score and had to score 100 on everything else just to get to 92. But I'm like, you guys have to know this was an honest mistake. I skipped a question. And if you go back, if you shift everything, all the answers are right. So,
So But you didn't have any challenges in school, right? I mean, you breezed through it nice and simple, right?
Well, I had some growth child issues. There are certain things that affected my psychological growth. Like I was an A student, but then something happened between my piano teacher and then my aunt and then my mom that created this circle of abuse that just um, made me build a character armor that just made me shut down. Scared of my own shadow, scared to fight back, scared to learn. And when I joined the army, knocked all of that out. And then all of a sudden, like you said, I just had this motivation. And then I tried, I was at Hunter, but I didn't want to go to school. I just wanted to play NCAA volleyball. And I know though they were D3, they had a D1 schedule, and these Dominican guys were just killing it. And so I was there for one semester to make sure school is what I wanted to do. Then had some survival issues, so I got the job at I was a student, part time student, like the program hire part
Yeah.
time students for this medical practice, and that medical practice allowed me to earn money and then return to school. So I auditioned for the BFA program, Bachelor of Fine Arts degree at Marymount Manhattan for acting, and it was a second rate program in the country, and I got lucky, got in, and that's how I finished. But like you, when I was in there, I was laser focused. Like my first 45 credits were A. I was a 4.0. But the problem is when you study theater, when you take an acting class, you're not judged by what you learn. You're judged by what they see, right? You could take a biology class. If the professor don't like you, if you get an A in the midterm and the finals, he can't do anything. Bye. Bye. Give me my A. But if you have six guys sitting and deciding if your scene deserves an A or a C, it's not necessarily meritocracy driven as much as it is subjective. So all of the classes that I didn't get A's were acting. So that told me something. Told me I should be a coach and use my acting ability to coach, which by the way has been understanding real human behavior in imaginary circumstances really helped me understand real human behavior in real circumstances, and playing to the character, playing to the referees, everything, none of it was real. Like me yelling at a referee, it wasn't out of anger. It was a lot of people. It's my big secret. Almost 90% of it's theater performance because I'm using it to get what I want. From the second ranked program in the country. Yep. But yeah, I don't know. We go back to the army and that ASVAB exam.
You know,
Yeah.
when you there were, I didn't have that bad of a challenge in the sense that, tests and stuff like that. But the reason why I asked is that I almost got kicked out of flight school because there's like my job is very secure. Like, you have to have the clearance and all that stuff, right?
Right.
So we have to have this area where it's secured and you do note taking and you're trying to, understand about the armament of your enemy and all that stuff. So I remember one time I'm there late at night studying because I have the next day's test. I'm in there studying. I'm kind of half asleep, half awake, but I have to cram and get this information in my head. And all the stuff that I'm studying is very classified, and it's active classified stuff. So then I leave and not realizing what I'm doing. And the next day, I get called in by the commander. So now I'm thinking, like, what did I do? Right? I don't know what I'm doing. This is right before the
Yeah.
test.
Yeah. He doesn't call you
And
in because you did something right.
yeah, the thing was is that I left compromised, data outside. It wasn't like, you sign things out, you're supposed to sign it back in. Well, I was so tired at night, I forgot. So they give you that scare tactic, that scare tactic, like, you're not going to take the next test. You're getting kicked out of flight. You get, all of a sudden I'm sitting there just sweating. And that's when I realized life is not in my hands anymore. This is out of my hands. And then now you put the faith in whatever, I'm a religious person. I said, take over. I don't know. So I remember that fear of like getting kicked out. And it's pretty traumatizing for that
Wow.
period of time.
Because that's your whole
And
life, dude.
my whole life, because I'm thinking like, they're working me up. I'm at my tail end of it. I've gone through enough, flight checks. I'm going to the simulators. I've gone and I'm at the tail end of it. And then all of a sudden, that one mistake is going to screw my whole. I mean, I'm looking back at that could have screwed everything. I mean, you talking about if I got kicked out, what's my mental state? am I now a pessimistic kind of guy, negative, like, oh, screw that, everybody's after me. I could have been that guy. But let me tell you, I got beat up, but what came out of the end was a positive outcome, of course. But
Mm-hmm.
that also put trust in, like someone greater than me, someone that I have to put faith into. So then from that point on, I think in those little forks in the road or those little obstacles, you start realizing, hey, I can do something. I got the ability, and have a projection going this way. So that was interesting. And when you
Huh.
start talking about MOS and training and as bad and all that, I was like, oh my gosh! It just flashed into that point of like almost losing everything. So
But you
this little
stuck to your
story.
virtue. Look,
I
bringing
mean,
it back to theater, sometimes good people fall, right? Because of an error in judgment. But if you stick to your virtue, which navigates your passions where it may, but your foundation, eventually sticking to your virtue, rinse and repeat, slowly digs you out of a hole that you never thought you'd get out of.
yeah,
And that we call that romanticism, where instead of being driven by passion, you're driven by virtue. Virtue is your foundation, and it navigates passions where they may. But as long as you keep that, somehow, some way, you always come out of the other end alive and well on your worst day, or smelling like a rose on your best day. You ever see Die Hard?
yeah,
Bruce Willis,
yeah,
right? He was a guy not endowed by superpowers. Didn't didn't jump 40 inches, didn't fly to the moon, didn't fight crime, can't stop, can't bend steel with his bare hands, right? More powerful than a locomotive, right? Superman. No, he's a regular person that made this error in judgment with his wife and wound up in this singular situation. And I don't want to sound like I admire you on this astronomical scale, but guys like me cheer for guys like you. We cheer for you. In that movie, right? He should. There's so many ways he should have died, but we cheer for him to live. And there's
yeah.
some instances where he's almost dead, and only in this scenario does he live through it, and he does, and he does, and he does. And I don't mean this. It's directly connected to what happened to you for your flight school thing, but you sticking to your virtue after your error in judgment allowed everything to come back full circle. They see that you're still scared and apprehensive and scared out of your mind, right? But you relied on something that you trust, or that you were taught, and I cheer for you, my friend.
Hey, I think I really appreciate it, man. Hey, listen, that was awesome. I really appreciate that compliment, but I hope I can be a quarter of what you even suggested about me. I'm
Yeah,
gonna put that into my memory bank and push myself. But I
yeah.
do remember that one particular question when they were asking me a difficult question. I told the truth. The truth will always set you free. And the good thing about me is I got a bad memory, so I got nothing else but the truth. I can't memorize lies.
Well, before we close out, I'd like to quote the great Jesse Ventura. If you tell the truth, you don't have to have a good memory.
It's pretty good right there.
Man, because after a while, all the lies you got to start remembering. It's like, I thought you said this. Okay, maybe I did. But if you tell the truth, you don't have to have a good memory.
The truth.
um, hey, let's plug in your site and your book a little bit before we get out of here.
Okay.
I think I'm gonna go
Yes.
pick up my kid.
So yeah, so my site you can go on RheeGen, which is RheeGen.com,
Mm-hmm.
and then you can see everything about the topical regenerative medicine cream, stem cell cream. And then if you have any questions, there's the info button. Click on info at RheeGen.com and ask me a question. And then my book, The Future of Regenerative Medicine, you can get that on Amazon. Just do Future of Regenerative Medicine and my last name, RHEE. And then you can see that book. And then there's the versions of hardbacks, paperback, and audio. And of course, the old, I don't know, ebook. That ebook there.
There it is. Yeah. Yep. Yeah, and I'd like you to come back on because after the book, you're going to have a ton of more feedback, patient experiences. Maybe we just come back on and just share fun stories because, oddly enough, as useful and productive as the science stuff was, I thought the stories we told at the end just were more, I don't know, I'm just a stickler for the dramatic. So I had more fun, believe it or not, with that.
Hey, I got a lot of stories about athletes and during like maybe
Hmm.
like world championship behind the scenes receiving a
Hmm.
medal and something happening back there. I'll give you some secrets about the backstage of some of these events and the turmoil that other
Hmm.
countries are. I mean, it's pretty interesting. You talk about a UN and what's going on in the geopolitical world. That
Right.
happens in the world stage of sporting events too. I mean,
Yeah.
there's a lot of bickering and fighting, and it's kind of unique on that world. So we can talk about that. We can talk about locker room fighting. Hey,
Yeah,
I'll
it's going
spill
to
the
be great.
beans. I won't say any names.
Oh man, I got a lot too. Speaking of locker room brawls, there's some of those things I keep secret until it's like the Kennedy files. You can only unlock it later where like people too old to care about
To where the yeah.
it. All right, guys. Dr. Rhee might love you guys, but I don't love any of you guys. In fact, I can't stand you. In fact, we're out of here. So for all of you at home, for all of you on your iPads or iPhones or Droids, if that still exists, I don't know. For all of you on your desktop who runs the world, old school people like me and this guy, where is he? That's Dr. Thomas Rhee. I'm Jason DeBass. This is episode 269 of the Option Podcast. Stay with me after this, but I'm going to hit my music for everybody else. We're out of here. So long. Love you guys. Come check out the Option Podcast on optionvb.com. It's also available on iTunes and Spotify and on YouTube under the NY Varsity Sports handle. You're going to love what you hear.